Welcome back to continue in our session. I don't know about you, but up here as chairman, I'm feeling stiff already. And so I hope you agree with me that I will now call upon our famous WEPRO dancing group to lead us in our mobility session. I think we need to stand up.
I think we can start. And we should come here.
It's on the way?
Oh, we don't have any.
Okay. Thank you very much, the WEPRO dancing group. I think that was worth it. May I now recall us back to our pre-lunch program, where a list of representatives were yet to comment on the statements made by the Director General and the Regional Director. So we shall now proceed back to me calling upon the first online is the representative of Mongolia. If I can allow you now to make a statement. Thank you, Mongolia.
Thank you, Mr. Chairman. First of all, Mongolia would like to thank Honorable Director General Tedros for the great summary of WHO's global priorities and clear vision moving forward. With this opportunity, we would also like to thank Dr. Shin for your decade-long commitment and hard work. We got benefited by your strong support, have enjoyed for your presence many times, the latest one being this July, when you came to Mongolia to celebrate 2018 World Hepatitis Day. Mongolia is uniquely positioned and committed to become the first country in the world successfully eradicating hepatitis C virus infection by 2020. Again, thank you, Dr. Shin, for all you have done for the health and well-being of 1.9 billion people. We wish you all the best in your future endeavor.
Thank you. May I call on the representative of New Zealand?
Mr. Chairman, Vice Chair, Director General, Regional Director, ministerial colleagues and delegates, on behalf of the Government of New Zealand, I would like to thank you, Dr. Shin, for the leadership you have shown, energy, enthusiasm, and the courage you have brought to the role. We should all be very proud of the achievements made in the region under your leadership in non-communicable diseases and many other public health priorities. It is certainly encouraging to hear that more people in our region are able to access universal health coverage, which is a necessity if we are to achieve health equity right across the region. We in New Zealand have made equity one of our focuses, and we would like to thank you as well as our Director General for the championship that you have taken in this area. New Zealand welcomes the report both from you, Dr. Tedros, and our Regional Director, Dr. Shin. New Zealand is committed to supporting the work of the WHO, and in particular the work in the Western Pacific region. We also support the 5-year strategy outlined by Dr. Tedros and the need to measure progress in order to know that we have made progress. New Zealand is committed, as I said earlier on, to achieving health equity. And as a new government, this is the #1 priority for the Minister of Health and myself as his associate. Mr. Chair, as well as our Director General, we would like to say that the election of our next regional director is critical to how the WHO responds to the needs in our region in the coming years. We look forward to continuing to work with the WHO and all of our fellow members, states on our critical health agenda items. Malo aupito, tēnā koutou, tēnā koutou, tēnā tātou katoa.
Thank you. May I call on the representative of Cook Islands?
Honourable Chair, Vice Chair, thank you very much, and may I congratulate you both on the new role. Kia ora ana, tūrau kia tātou katoa I te iawate ai. As new Minister of Health for the Cook Islands and new Chair for the Pacific Health Ministers, it is an honour for me to greet you all, for on behalf also of the Government of the Cook Islands. Honourable Dr. Shin, Honourable Tedros, Honourable Ministers and distinguished guests, kia ora ana, and warm Pacific greetings to you all. On behalf of all Pacific Health Ministers, I also extend greetings from the previous Minister and previous Chair of the Ministers of the Pacific, Nandi Glassy, to you and especially to you, Dr. Shin. We extend our sincere appreciation and a thank you for the support offered to all Pacific countries over the past years under your leadership, as well as the Cook Islands. However, as mentioned earlier, we still face many challenges. So we acknowledge the continued commitment of WIPRO to providing support to better health for all, and to further strengthen universal health coverage and primary health care, as well as climate change and better health, to ensure access to quality and affordable health system is available to all so that no one is left behind. Which brings me to the heartwarming story you shared, Dr. Shin, about the young woman you met who had just given birth to her second child, her hopes and fears for her child. That is common to many of us women today, especially from myself, a mother of 5 children. We constantly worry about the well-being of our children and their future. So that is why we are here together, and we should always be together as a whole, as a family. Let us continue to paddle our canoe forward and remind us all why we are here today. We are here for our people, for our families, for our children. So once again, Dr. Shin, we wish you all the best for your future endeavors, and may the blessings of the Lord continue to be with you always. Kia orana e kia manuia.
Thank you. May I now call on the representative of Tuvalu.
Honorable Chair, thank you for the opportunity. First, we have to thank our Heavenly Father for life and the opportunity to meet again. Thank you, Dr. Tedros and Dr. Shin, for your report and your leadership and the passion on health. Greetings to the new honorable ministers and leaders of the delegation as their first time in this WIPRO meeting. Dr. Shin, thank you all for the achievement you have provided to this region during your tenure. Thank you also for your leadership and your guidance to this region on the country's health issues. Tuvalu, in its effort to achieve universal health coverage, is supported politically. I am happy to inform this meeting that we cover about 99% health coverage, including overseas treatment for all our people. I would like to acknowledge the assistance from the Republic of China, Taiwan, for contributing to make this a reality. Tuvalu's effort to have a health system that captures all disease was very successful by having yearly forum, by engaging all communities leaders, church leaders, women leaders, youth leaders, teachers, and so on. Dr. Shin, thank you for your story about the newborn baby future. To recognize the country's health issues is not only by reading their reports, but most importantly, by visiting the countries and hear their stories. WIPRO have 37 countries. Surely a 5 years and a 10 years term, a visit to all the countries can be achieved, whether it's big or small, by both. All are important, but no effort has been made. This is also a challenge to the Director General of WHO, Dr. Tedros. Tuvalu asks the new WIPRO Director General to take this concern on board. This can be part of the solution to the many health issues that we shared in most meetings. You only can appreciate the small island countries by visiting them and hearing their cry in their own context. Again, thank you, Dr. Shin, and wish you all the best in your future endeavors from the government and the people of Tuvalu. Thank you.
Thank you. Are there any more representatives who wish to speak on the topic? It is now my pleasure to ask both the Director General and the Regional Director to respond to the points that have been made, but before they do so, as Chair, I want to express my sincere thank you to every one of you that have spoken and that have shared your experiences, and more importantly, the leadership that you are providing individual countries. I now ask firstly the Director General to respond to the comments that have been made.
Yeah, thank you, Chair. And I would like to thank all member states, countries and areas for your comments. Most of them were actually presented as recommendations. So we take the recommendations seriously, and we will do our follow-up. Not many questions, but I would like to comment on some of the issues, especially related to small island developing states. I hear you very well, and as you remember, including during my campaign, one of the major pillars, one of the 4 pillars of my priority was actually climate change and health. And based on that, we have already launched the SEEDS initiative during COP23 that was hosted in Bonn last March. And we're already now consulting to identify areas of priority in the initiative. And we have done the consultation with Pacific Islands, with Indian Ocean Islands, and now the last one that will be held in Grenada this month in October will be for the CARICOM countries. Once we finalize that, we will have a regional plan of action for all 3 regions. And then that will be compiled in order to have the global action plan. And that global action plan will be discussed during the next World Health Assembly. That's May 2019. And we will have also a side event. And during lunch, we had a good discussion with my brothers and sisters from the SEEDS countries here from Pacific. And our chair suggested that side event, a high-level side event, should also be considered for September 2019. And that would actually help, especially since it's going to happen after the May Assembly. So I think there will be lots of activities. In addition to that, we will have the Pacific Health Ministers meeting in August, and that hopefully will strengthen our case in order to use the opportunities that we will have during the September UN General Assembly. So the progress is okay in terms of the plan of action. But on the other hand, one of the major challenges is the financing part. And we discussed about the progress on the green, what do you call it? Climate change. Green climate finance, GCF. And as you know, the funding amount now for the climate change and health is only 2%, while through health you can address both mitigation and adaptation. And that's not acceptable. So we're mobilizing now countries to help, especially in the financing part. And I think the one voice from not only Pacific, but all small island and developing states will be very important. So the progress so far is okay, but we have to do everything to finalize the action plan as soon as possible, and also address the financing part. From WHO side, we will continue our commitment because it's very important. Of course, the whole world is affected by climate change, but the small island and developing states are more affected than any part of the world. So that's why the commitment of all countries or the whole world is very important. At the end of the day, it's not about just the small island and developing states. It's about us. Okay, those who are being affected immediately and currently could be the small islands. But sooner or later, the whole world is in danger. So we do it for us, not just for the small island only. We do it for us. And that's what we're trying to underline and promote globally. Then the other element I would like to comment on is on primary health care, especially there is a very good experience in this region on universal health coverage. And from universal health coverage, primary health care, as you know, is the foundation of universal health coverage. And we will be having our meeting in Astana in a few weeks from today. And we have to make that conference, primary healthcare conference, as successful as possible. And we have to renew our commitment. And I saw already from your comments, your commitment to primary healthcare. And I really urge you to attend the conference in really full force and make the conference as successful as possible, because it's very important. Then the third part, my comment again, which is based on your comments, is NCDs and TB, the high-level meeting we had last September in New York. It was a successful meeting, but at the same time, the success is so far on, the commitments we have shown, meaning on papers and so on. The real commitment starts now. And we have to translate the two declarations into action, both TB and NCDs. And I have already heard from you how you're preparing or working on both TB and NCDs. I commend you on that, but we have to be more aggressive and address both TB and NCDs based on the declaration. I believe that it's really time to be as aggressive as possible on these two issues. And the last is on antimicrobial resistance. As you know, the interagency group is finalizing its report to the Secretary General. And based on that, the UN General Assembly will discuss. Of course, we believe this will increase the momentum, but we have to also recognize that the antimicrobial resistance problem is really, really serious. And we have to be as serious, more serious than the problem itself. We started it late. Of course, it's late. It's better late than never. But there is a job we have to really catch up and to be as aggressive as possible. So on the antimicrobial resistance side, I think it's the commitment of all countries, and especially the national action plans that many countries, especially in this region, have prepared, and translating that into action will be important. To be honest, the follow-up meeting in New York will help us to mobilize political support. But we don't need to wait until then. I said we're late, and we have to, every day we have to make sure that we're working hard on antimicrobial resistance to address that. Then the final part is part of my speech, which I have already said, the issues that you're discussing this time, the neglected tropical diseases, on hospital management, on digital health. These are very, very important items you have selected. And the outcome of that will also help in making progress in those areas. And I wish you all the best and hope you will consider the suggestions I made during my speech. So thank you so much again. I will be around until Wednesday evening. So I will participate and contribute whatever I can. But more importantly, I will learn from you. And use this opportunity to listen to, as what our minister from Tuvalu said, from all of you, in order to prepare WHO to best serve you. Thank you.
Thank you very much, Dr. Tedros. I now ask the Regional Director to respond.
Well, I sincerely thank all member states for their kind and gracious words today. I'm humbled by all of your good wishes. As I said this morning, all of this achievement we heard about this morning are thanks to you, all member states. During my terms as RD, I've just tried to make WHO the partner and support that you need to deliver on your health priorities. For many of ministers and delegates around this table today, like my old friends, Minister Dr. Pung Kong from Lao PDR, Minister Dr. Tuitama from Samoa, Dr. Tien Kim from Vietnam, State Secretary Dr. Wong Hat, Cambodia, and Dr. Ni Mingju from China, and Dr. Grang Zhong from New Caledonia, and Ms. Anne Blackwood from USA, and many other friends. We've been working together for almost all of 10 years I've been in this role. I will always cherish the many wonderful friendships that I have made during my time in this shop. I'm sincerely grateful to all member states for the tremendous support you have given to me during my time as a regional director. I hope you will extend the same support to whoever you choose tomorrow to be my successor. The spirit of solidarity and collaborations within this region is incredibly strong. I learned from my early days with WHO that when you join WHO, you join not just a workplace, but you join a family. I feel that that is true not only of my hardworking, dedicated staff, but also about our member state. I'll miss working with you all of you, and I know you will all keep working very hard to deliver better health for the people of our own wonderful region. Thank you. Thank you very much.
Thank you, Dr. Tedros and Dr. Shin, for those wonderful responses. We now move to agenda item number 9 on program budget 2016-2017. This agenda item, program budget 2016-2017 on budget performance, document WPR/RC69/3. May I request the Acting Director, Program Management, to introduce this item.
Thank you, Chair. Distinguished representatives, I'm pleased to present document WPR R69/3 on the final report of the budget performance for the biennium 2016-2017. The WHO Program Budget 2016-2017 is the second of 3 biennial budgets formulated under the 12th General Program of Work 2014-2019. All the figures I'll be mentioning are in US dollars. The approved Program Budget 2016-2017 for the Western Pacific region was $285.6 million, as shown in Table 1 of the working document. During the biennium, there was a net increase in the region's program budget ceiling of $13.4 million. Thus, the final working allocation for the region was $299 million. The total amount of funds available from all sources was $227.8 million, or 76.2% of the final working allocation, as shown in Table 2. 98.8% of available resources were utilised during 2016-2017, and you may find more details on that in Table 3A. Funds utilisation by category of expenditure is available in Table 5A. For country offices with resources of more than $10 million, Country Office Budget Centre utilisation by expenditure category is available in Table 5B. External auditors performed audits of the WHO Representative Office in the Lao People's Democratic Republic, the recommendations from which have been implemented and closed. And the implementation of audit recommendations for the regional office in Manila is progressing as per schedule. Internal auditors performed an audit of the WHO Representative Office in Malaysia. They also performed the first integrated audit of the WHO World Emergencies Program in the regional office. The WHO Malaysia office received a satisfactory rating, which means that satisfactory controls are in place to mitigate key risks. Meanwhile, the regional WHO Health Emergencies Program received a partially satisfactory rating, and that's already led to the implementation of improved controls and processes. Secretariat continues to improve controls through strengthened management, training, communication, and monitoring of potential high-risk transaction areas in the region. The results can be seen in improved donor reporting, direct financial cooperation contracts, and goods and services procurement. The region continues to maintain zero overdue direct financial cooperation reports. Continuous efforts of the Secretariat have also led to no overdue donor reports. What's more, the status of all cash and bank account reconciliations has been reported with an A rating. This means that no reconciliation items were pending for longer than 90 days. With respect to staff performance management, the region was the only one of the 6 WHO regions to achieve 100% compliance on the timely submission of the Performance Management and Development System assessments. Gender balance and geographical distribution of staff continue to be priorities. As of December 2017, the portion of female staff was 44.91% in the region, and our 167 professional staff hail from 37 countries in all. The annex of the report contains more details of the end of biennium assessment for the program budget 2016-2017. Overall, only 2 outputs were assessed as not fully delivered. Both are under the Violence and Injuries Prevention Program. They were 2.3.2, countries and partners enabled to develop and implement programs and plans to prevent child injuries, and 2.3.3, development and implementation of policies and programs to address violence against women, youth and children facilitated. They were not fully delivered, largely due to lack of funding. The program received only 41% of its planned costs, and country-specific projects earmarked most of the donor funds for road safety, leaving less to address violence issues. We're pleased to answer any questions you may have on this final report. Thank you, Chair.
Sorry, my mic wasn't on. Thank you. May I now call upon the representative of the Republic of Korea?
Thank you, Mr. Chair. The Republic of Korea notes with pleasure that Wipro has implemented 98.8%, almost 99% of the total available resources, and that the Secretariat has also fully delivered 92 items out of total 94 outputs for the biennium 2016-17. My government highly commends Wipro for achieving such a strong budget performance. In addition, Korea supports Wipro's bold action on staff restructuring to cut human resource costs that account for the largest share of spending in the Western Pacific region. My government also values Wipro's ongoing endeavor to increase transparency and efficiency by improving donor accountability and building a better monitoring and control system. However, Korea notes with concern that the current budget gaps in the region as predictable funding, including core voluntary contribution, continues to decline, and that some programs remain chronically underfunded. We hope that the adequate solution will be found to address these concerns in the near future. Thank you for your kind attention.
Thank you. I call on the representative of Philippines.
Thank you, Mr. Chair. The Philippines appreciates the final report on the utilization of the program budget of the Western Pacific region for the 2016 to 2017 biennium, and certainly congratulates the Secretariat for recording 98.8% utilization of all sources by funds of the region, as well as 97.9% full delivery of outputs. Our country continues to benefit from the technical assistance being provided by the WHO through the country office across all programs, complementing national efforts in attaining our health goals. Some of these assistances reflected in the report are the development of the Philippines Strategic TB Elimination Plan 1, maternal and neonatal tetanus or MNT elimination, making immunization policy based on scientific evidence, environmental surveillance, and strengthening disaster risk management for health, the conflict in Marawi, among others. Specifically, in line with the WHO's commitment to support member state priorities and its commitment to keep countries at the center of the organization's work, the Philippines looks forward to the following. First, continued partnership with the WHO, specifically the country office, in ensuring that voluntary contributions will not be biased towards areas where donors are attracted to support. Second, voluntary contributions shall also be utilized to support agreed priorities of the country cooperation strategy. Thank you, Mr. Chair.
Thank you. May I now call upon the representative of Samoa.
Mr. Chairman, Samoa commends the Western Pacific region for a high utilization of funds for the biennium 2016 to 2017. This indicates that the region is more aware and committed to ensuring that much-needed programs are completed in time and that the financial resources being given are best utilized. Samoa also congratulates the WHO for prioritizing gender balance initiatives in its staff recruitment policies. And with an increase of the proportion of female staff during this biennium, we expect a brighter future and an increase in gender financing programs through a more balanced view on health matters. Moreover, Samoa acknowledges the institutionalization of compliance audits in order to ensure accountability and transparency to promote best practices and efficiency. There are, however, matters which Samoa would like to raise for the Western Pacific region to consider in close attention. One, 43% of international professional staff was noted to be from outside the region is a significant proportion. Hence, the region needs to assess closely why these positions cannot be filled by regional and national personnel who are qualified, experienced, and understand the context of our region. Two, compliance audits is important in terms of adhering to policies and legislations in place. However, if we really want to measure the value of our investment, then we would need to incorporate more of outcome-based indicators in our cooperation strategies as well as in our work plans. This will be a better measure of value for money in relation to impacts on the health of our region. 3, while the institutionalization of audits is a crucial measure for accountability, Samoa believes that there still needs to have more flexibility in the allocation and reallocation of funds from category to category. Reality has shown that health priorities can dramatically shift and evolve, especially post-disaster situations. 4th, with climate change being more evident in the Pacific region, this will only lead to more pressure and burden to countries regarding the control of non-communicable diseases, communicable diseases, and emerging and re-emerging diseases. Samoa would like to see more financial resources invested in these areas, including climate change, informed surveillance, and climate change early warning systems. I thank you.
Thank you. May I call on the representative of France?
Merci, Monsieur le Président.
Thank you, Mr. Chair. France takes the floor for the first time. Therefore, we would like to thank the Secretariat for the organization of this regional committee meeting, as well as Dr. Sheen for his 10 years of service. Regarding the implementation of the 2016-2017 budget, France takes a good note of the report and welcomes the excellent implementation of the program budget. France also welcomes the controls and internal and external audits performed, which led to the identification of good practices to disseminate as well as improvement areas in country offices and the regional office. We would like to urge the regional committee to further these controls and recall France's repeated call for increased transparency and accountability at all levels of WHO.
Thank you. May I now call upon the representative of China?
Thank you, Chair. And thank you, Secretariat, for the report program budget 2016-2017 budget performance. The overall utilization rate for 2016-2017 has reached 98.8%. Most expected outputs have been fully delivered thanks to the continuous effort of the Secretariat. The staff cost compared with that of the last biennium has declined. The travel cost has gone down by 17.8%. The efficiency and outputs of DFC has increased. And the gender balance and the geographic distribution of the staff of the Secretariat has been improved. We appreciate that. What deserves our attention is that despite a high utilization rate in 2016-2017, the financial gaps for base programs and emergencies have maintained about 24%. And the voluntary contribution has declined by 20% because of lack of human resources and funding. The outputs concerning preventing children injuries and violence against women and children are partially delivered. We hope that the Secretariat can step up its effort in financing, especially in the area where the outputs are affected by lack of funding. We have noted that the voluntary contribution has declined. We want to know, is a declining voluntary contribution a trend? How does the financing go for 2018 and 2019? Has the Secretariat assessed the current financing situation and has taken countermeasures? Thank you.
Representative of the United States of America.
Thank you very much, Chair. Let me start by just briefly mentioning under the previous topic our thanks to the Director General, his important comments on the priority issues before WHO, the WHO transformation work that is ongoing. I note in particular the remarks on the normative work, particularly what is being produced and for what purpose, how it's being communicated, and WHO doing the right things in that regard. This is an important issue for us as well. Dr. Chen, thank you for your many successes in the region. And as the DG said, I think it said it best, your contributions are helping build WHO for the future. So you're leaving a good legacy in the region. Thank you. So on the report, the United States does appreciate this report. We congratulate the close to 100% utilization rate of the resources for the biennium. We acknowledge the work of the Secretariat and the important work of the internal audit and external auditors. We encourage the Western Pacific Regional Office to continue to improve management and financial controls as outlined in this report, and commend the work to assure accountability to donors. We congratulate the region for diversity in terms of gender balance and geographical distribution of staff, including the increased proportion of female staff, and encourage further progress. With regards to the audit activities, just such an important accountability tool for the region, one stood out to us, in particular, the partially satisfactory rating for the WHO Health Emergencies Program. We note that this has led to implementation of improved controls and processes, and we'd be interested in more on that, given this is such a critical issue for the region in terms of the need for health emergency preparedness and response. Thank you.
Thank you. May I call on the representative of Micronesia?
Thank you, Mr. Chair. First of all, please allow me to say words of respect and appreciation to Director General Dr. Tedros for your vision to work within the Pacific region. And I also would like to thank Dr. Shin Young-soo for your legacy left behind in the Northern Pacific will not be forgotten, even if there's a disaster with our WHO office established in the Federated States and with the Northern Pacific, 3 countries over there. Thank you, Dr. Shin Young-soo. As to the budget, Mr. Chair, I thank the WHO Secretariat for providing the background documents that lead up to the 2016 and 17 and proposed for 2017 to 18. Let me highlight some of the aspects of the budget preparation that I thought are worth to highlight from our perspective of the Federated States of Micronesia FSM. First, Mr. Chair, I appreciate the fact that there is reference in the country budgetary consultation that said it will take country priorities into account when finalizing the budget. To me, this is very highly encouraging. I said this because in the case of FSM, we have put together a country cooperation strategy plan of 2018 to 2022, and I hope the priorities identified in there will be reflected in the final WHO regional budget. Secondly, Mr. Chair, and again, based on the principle of making a difference at the community level toward universal health coverage, I encourage WHO regional office to consider the strengthening the capacity of WHO CLO for the Northern Pacific Micronesia office. The 3 staff office, they are excellently performing at the moment. However, given the widespread of the Northern Pacific region, we will really appreciate the request of the international specialized experts in addition to the existing staff now. And I can assure you that WHO will be able to deliver on the many goals and the targets it wishes to meet at the community level. FSM wishes to register this request to WHO when finalizing the budget. Lastly, Mr. Chair, we welcome the budget performance report the Secretariat provided, which summarizes all the activities carried out in 2016-17. And this report shows that WHO had delivered on most, if not all, of the funded activities. And I thank you very much for your kind attention.
Thank you. May I call upon the representative of Malaysia?
Thank you, Mr. Chair. Malaysia has reviewed and takes note of the final report on the utilization of Program Budget 2016-2017. We wish to express our sincere appreciation to WHO for the funding provided over the last biennium of 2016-2017 under the program budget. With financial constraints and budget cuts, the monetary funding and technical expertise that has been provided by WHO has certainly strengthened our healthcare delivery to the people. Nevertheless, we wish to make a constructive comment for the WHO Secretariat's consideration. Whilst we appreciate that there are rigorous methods involved in identifying and appointing a suitable WHO consultant to assist with these projects, this component of the process has taken a substantial amount in the past, and that had been one of our biggest challenges in being able to implement projects on time. Moving forward, Malaysia hopes that this process could be enhanced so that the WHO consultants can be appointed in timely manner, and this would ensure that projects are completed within the stipulated timeline. Thank you.
Thank you. May I now call on the representative of Japan?
Thank you, Chair. We welcome the Secretariat's efforts to improve the management of travel expenses and direct financial cooperation. Also, we highly evaluate the effort for delivering 97.9% of the proposed outcome during this biennium. However, we are concerned that the voluntary contributions to WIPRO have been decreasing year by year. In addition to its continued efforts in securing funds, we would like to ask the Secretariat to try to use these funds efficiently, given the decreasing level of its financial resources, and improve transparency to invite more financial support. Thank you.
Thank you. May I now call on the Secretariat to respond to the points that have been made?
Thank you, Chair. If, with your permission, I might ask my colleague, Jeff Cobzer, the Director of Administration and Finance, to respond to a lot of the points made.
Thank you, Chair. And thank you very much for all the very positive interventions. I think the interventions show how seriously we take our financial fiduciary responsibilities in the region. We are a region that does have a culture of compliance. I think that comes out in the comments you made and the report that we presented. We take audits very seriously. We do believe in accountability and transparency. And I think we will continue to do so. I think it's in our nature of who we are and what we do in this region. To go to a couple of the different specific questions that came up, I'll try to focus on the issues that came up on human resources, and then the specific one on audit, the question about the audit I can take. So for human resources, there's so much that has been going on in the last 10 years in the human resources area. And it continues to change, to evolve, to improve. And even with Dr. Tedros here in the transformation that he has led, we continue to look at ways to do things better. recruiting the right people at the right time in the right place. And because of that, we've done a lot of things in Wipro as well that we can show through our gender balance statistics, as many of you have mentioned. Actually, when Dr. Shin started 10 years ago, we had 32% international professional female staff. And as of yesterday, I looked at our data because we have real-time data monitoring tool that we check all the time on all these things. It was 46%. So we have been very aware that we had low gender balance, and we have worked within the rules, but to find ways to manage our processes in HR to allow us to find the best candidate, but also to attract female candidates who have come to the top in the recruitment process. So we're quite proud of that, and we've actually done some pretty good things on recruitment, even though it seems like to a lot of my colleagues and maybe some of you too that HR recruiting takes a long time. We've set a target of 90 days. And from 2016 to 2018, we've met that almost half of the time. Our average is about 116 days per recruitment for staff. And we're well within the global average, which I think I saw at a recent paper was 165 days. So, and we're doing that in a way where we're still trying to make sure we get the right people. And that means we have to be very fair in the process. We have to be very thorough. We actually add one step that others don't. So we try to make sure we have the best fit. I mean, we do that through a process that a committee makes a recommendation up to the regional director after the usual interviews go through. So we're very aware, and we're also quite proud, of course, of our mobility in the region. That was a policy that Dr. Shin started, and we basically have people. Once they've been around 5 years in the region, we're actively and successfully moving them to all over the globe. And I think this goes to the one of the comments from Samoa, because to us it's less about where people are from, but what they can bring to the region. So we believe that the best people we want to have. We believe in mobility, which means we're going to be moving people not only into the region from outside the region, but also from the region to outside the region. And we'll continue to do that. But we do have, I think, to your point, we have underrepresentation or unrepresented countries. And we want to do better there. We've reached out to we're working with a number of member states to have recruitment workshops so people understand better how we manage our recruitments in WHO and what are some of the success factors. And we'll continue to do that. And I think we're showing some results from that too. So point very well taken, and we will continue to try to get better in that area. And we want good staff from everywhere, including all of your countries. And then finally, I think specifically on the health emergency program audit, I think our director of health emergency sitting back here, poor Ilan, it was actually the first operational audit of this program anywhere. They actually chose Wipro because we have a stellar reputation in this area, and they wanted to see how we were performing. True, it was a partially satisfactory audit. We actually have never had an unsatisfactory audit, but they looked at 137 control points, actually. They took our financial regulations, our emergency regulations, and they looked at all of the different SOPs that have been developed, and a lot of them are new. A lot of them have been done within the last 12 to 18 months. And we didn't quite have them done. So what this audit did was actually help us focus on those areas we needed to. So I mean, the RD, the DPM got involved talking to the auditors because we feel like we feel very strongly, and I think I heard it from some of you already, that we have a very good program. It doesn't always come out in the audit, but what we do know is that this audit will help us improve in those areas, and we'll take that very seriously. Thank you.
Thank you. Are there any further comments from the Secretariat? Thank you.
Just a couple of brief ones. Thank you, Chair. Just a couple of member states or a number of member states raised questions about underfunded areas, particularly the area of violence and also the sort of related area of VC trends and things like that. Certainly, not surprisingly, underfunded areas are something that we are acutely conscious of. And in the case of injury, I know that Dr. Hariam Shin, the my counterpart, who's the director of that division, is very actively aware of that. It is something that we talk very actively with existing donors about, and as part of resource mobilisation, we also talk to other potential supporters, and of course, our headquarters colleagues are very actively engaged in those sort of resource mobilisation areas. One thing I will say about trends, so far this year, there's been an increase. Our projections are showing a bit of an increase in voluntary contributions. Of course, it's relatively new at this point, but the projection is about an increase of about $10 million US dollars so far. But you know, we're early into the biennium so far. The other point I was just going to reference was the request from Federated States of Micronesia about strengthening the office, and it's we're certainly very conscious of the important role that all of our offices play, including that office with very limited resources for a number of the countries, and it's even more front of mind for regional office, the regional office part of the organisation, because we're conscious that in a lot of ways, for practical reasons, we're kind of the first point of support for a lot of the things that office is trying to do with you in the Northern Pacific. So that is something that of course in our planning we'll be looking very hard at you know, how we can maximise the resources going into our various country offices, and you've heard from the Director General how important that is as a global trend for the organisation. But that's probably all I should take your time by saying now, other than to say that as I think has been made clear, this performing well in these areas is very important in our region. We take it quite seriously. We appreciate the positive feedback that many of you have given, but our approach to this is one of continuous improvement. So we hope to keep on deserving positive feedback from you in future years as we continue to improve in our efforts to drive efficiency and effectiveness of our work. So thank you.
Are there any further final comments? If there are no further comments, the committee notes the update on the program budget 2016-2017, and we can close this agenda item. Thank you. We are doing extremely well today. And so because of that, I would ask us to go to agenda item number 10 before we conclude the day. Proposed Program Budget 2020-2021. We now move on to the next agenda item 10, Proposed Program Budget 2020 to 2021, document WPR/RC69/4. May I now request the Acting Director of Program Management to introduce this item.
Thank you again, Chair and distinguished representatives. I'm pleased to present document WPR RC69/4 on the proposed high-level program budget for 2020-2021. In May, the World Health Assembly adopted the 13th General Program of Work, 2019-2023. GPW 13, as it's known, spelled out an ambitious vision for global health in the age of the Sustainable Development Goals. For WHO regions, the program budget is the primary instrument for translating this bold vision and strategy into concrete actions and results at country level. The bottom-up development and planning process in the Western Pacific region has identified key priority outcomes. We've ensured that budget priorities are based on needs and driven by results at the country level. The proposed high-level program budget 2020-2021 Regional Committee consultation document provides an overall budget indication by major office and split by country and regional levels. Globally, the total proposed program budget amounts to $4,687.8 million. Again, all figures are still in US dollars. Now, with your permission, Chair, I'll now jointly present the program budget 2020-2021, with Mr. Imre Hollow, the Director of Planning, Resource Coordination and Performance Monitoring from WHO Headquarters. Thank you, Chair.
Thank you very much, Mr. Chair and ladies and gentlemen. we are going to split the presentation with Mark. I'm going to talk about the global context, a little bit about the new planning process, and also explain a bit more in more detail the high-level budget figures. And then Mark is going to talk about the outcome of the regional prioritization process that took place leading up to this regional committee. Just to take a step back and remind us what the new budget process is about and the new planning process is about. So first of all, this is about the implementation of the SDGs and to support countries in this implementation process. That's one of the key drivers of the budget, as well as it was of the GPW 13. Secondly, the prioritization that Mark is going to talk about that also took place in every region is the key shaper of that process. Thirdly, one of the new elements of the GPW 13 as well as Program Budget 2021 is the absolute commitment to measure the impact of what is it that we are achieving. It is not new. We've done it before, but now there's a much more increased focus, and you have seen that with the impact framework that we presented along with the GPW 13, and that gives us also much more accountability for what we are going to achieve. Behind the program budget, of course, is GPW 13 and a bottom-up planning process that came about from this prioritization exercise that you all have been part to. So the first part, we are here now, we present to you a high-level program budget, which is only at the level of major offices and by the 3 levels of the organization, because we needed time and that's the second part, to cost out the outputs that lead to the outcomes in order to come up with a more detailed program budget, which we are going to present at the executive board in January. And that's the third step. Once that's done, based on discussions at the executive board, just like before, we're going to present a revised version to the World Health Assembly in May, and hopefully when it is approved, then we go to operational planning, which is the last phase. So we are now really at the very beginning of this process. In terms of overall figures, the budget, there's an overall increase of 266 million from 4.4 billion to 4.7. And the base budget increases from 3.5 to 3.9 billion, 13%. Here, I would like to draw your attention to the fact that the polio component were provisional at the time we presented it, because the polio oversight board was yet to meet. And they did meet in September, actually, I think a week ago, and they are coming up with different numbers in light of the different pace of the polio eradication. So actually, there's not going to be a decrease in the polio component of the budget for 2021. The ramp down is going to be shifted a bit by a couple of years. But because that component is not in our control, I really would like to focus on the base budget, as this is the one where the governing bodies have the most say. So what is the 13% increase consist of that you have in front of you? So out of the $469 million that we are proposing to increase the base budget with, more than half, 227 million, is related to polio transition. And this is really not the right expression to use to call it polio transition. What we're talking about is maintaining and guaranteeing those core public health functions like surveillance and vaccination etc., which have been previously not only funded but also budgeted under the polio segment. But they were also always going to be core WHO work. And now that the polio is ramping down, it is important to rectify that issue and bring back these core functions to the WHO base segment where it belongs. We are currently having a conversation with our colleagues in polio whether we should keep this in light of the changed polio timeline or not. My position is that we have to keep it because that sends the signal that these functions are actually core to WHO, vaccination, surveillance, etc. It's not only related to polio. But this is, I think, going to be a discussion in the coming weeks. The second component of the increase, 132 million, is increasing country capacity everywhere, where in order to implement the ambitious goals of GPW 13. Then the third big element is $108 million increase in data and innovation, which is really, again, about strengthening partly capacities also in country offices to be able to measure and report on the targets which are in the impact framework and which are all related to the SDGs. And there's one element which you might look at with some questions, which is a $42 million addition related to the United Nations reform. This is currently a placeholder. There is, according to the General Assembly resolution last year, there's going to be a 1% levy on all voluntary contributions which are related to development. The amount, and this is what we're currently doing, we're currently discussing with other UN agencies how to calculate this amount. That's not yet sure, so we took sort of the worst case scenario and calculated how much it would be if all the voluntary contributions without polio would be taxed by this 1%. And there's also an increase of the flat rate that we have to pay to support the UN resident coordinator system. And that's also included in that. So for the time being, that amount will still need to be further refined, but it has to go from somewhere. And I think it's important that we show it to you. So once we do the budget increase, so where does the money go? And basically, most of the increase is going to country offices. And as a result, you will see that the shares, if you look at the levels of the organization, change quite dramatically. Until now, the share of the country offices in the total budget was 38%. And it will be only almost 43% as a result of this change, as also the Director General referred to it in his speech. The regional offices share will remain about the same, and headquarters share as a percentage of the total budget will decrease from 38% to 33.8%, which is quite a big difference. What does it mean for WIPRO? So 281 million was WIPRO's budget base budget for 2018-19. And as a result of all these increases, the new budget proposed for the region will go up to 313 million, almost 314 million. And half of that is related to increasing capacities in country offices, and the other one is on data and innovation functions, which are also key according to the new GPW. And my last slide, it's a very complicated one, but it basically has three main messages. The first is that we believe that this proposal of budget increase is realistic. This biennium, we already have 91% of the resources secured, which is relatively early at this time of the biennium. Therefore, we're quite sure that we will be able to fundraise for that higher budget. In line with that, we're not proposing an AC increase, so an increase in SS contributions. We believe that we can cover this increase from voluntary contributions. And the third message is that we're going through a very substantial reform of our resource mobilization, and many of the members of the Secretariat here from WIPRO are also member of that. And we're quite positive that reform will also bring additional resources to the table. With that, I would give the floor to Mark.
Thank you, Imre. Just 3 slides from me just to provide a bit of an update of the process that's been undertaken and is being undertaken with all of your member states here in WIPRO. And that's operationalising this thinking around the GPW 13. And obviously the fundamental purpose is to continue with the bottom-up planning that's been happening and engage with all of you on what the strategic priorities for your countries and areas are within GPW 13, and to then gently identify those priority outcomes to be focused on. And so to the process that's been followed that hopefully many of you are aware of there's been facilitated consultations involving the WRs in the member states where there are WRs present. Also involving the WHO sub-regional offices, particularly the DPS office in Fiji, for countries and areas without WHO presence. And also in the case of Brunei and Singapore, there's been facilitated consultation with the responsible country office based in Malaysia, and there's been formal and informal consultations as part of that. Now, Now, what ended up, this is just a summary of what were the most common outcomes that were prioritised by member states in WIPRO through this process. So there were 27 member states that included in their priority list 1.1 essential health services there as a high priority. Then the second most commonly mentioned one was 3.3, health and all policies and healthy settings. Then the next one there you can see was 3.2, risk factors reduced. Then emergency preparedness, then data and innovation, then determinants of health addressed, then essential medicines, vaccines, and so on, infectious hazards prevented, emergency detection and response, and financial hardships reduced. So just a reminder that 1.1 essential health services actually includes a whole lot of things that, like, for instance, a whole lot of the disease-specific programs are in 1.1. So it's actually probably not surprising that features so strongly. Now, below those outcomes, there are a whole lot of targets, possible targets that there's been discussions with member states on in terms of what are the priority targets that you wanted to focus on. These are the 15 most commonly selected and prioritised targets. Now, I won't go through all of those. You can see them there on the screen, but again, they're in order. So the single most common target that member states identified as a priority for you was increased IHR capacity and health emergency preparedness. Then it was increased access to essential health services. Then it was reducing tobacco use and NCD-related mortality reduction, essential medicines, reduction of hypertension, and so on. So there's quite a mix across the different areas amongst those targets, but probably none of them would come as great surprise, would be my suspicion. So that's really just, of course, I mean, all the different member states you all came up with your own lists in the discussion, but these are the most commonly featured targets that came out of that. Now, Imre, did you want to talk to this last slide, or shall I? Okay. No, you go ahead.
So I just want to tell you where we are right now. So we've just launched the development of the country support plan exercise. And this is also very new in many ways, because this is the first time that headquarters is actually concretely taking part in the planning process. Until now, planning process was pretty much between the regional office and country offices, and headquarters went about it slightly differently in their own way. So now we're making this exercise sequenced. So first, the country office defines what does it take to help from the Secretariat perspective reach these priorities, and then defines the resource requirements that are needed, and then defines what are the resources that are readily available at the country office. Then in consultation with the regional office, what will be the resources that will be given by the regional office? And then thirdly, what are the resources and help that headquarters is going to provide in that country office? Which is a big change because it will also drive the work and the composition of the work in headquarters. So it's quite a big change. Once we have that, that will help us to basically cost out the outputs, both by major office, but also globally, that will feed into the executive board version of the program budget. And then from then on, we will, as I said earlier, follow the traditional route and present the budget at the WHA based on these outcomes. So we're very much looking forward for your guidance and input that we will, of course, build into the next version of the program budget. Thank you.
Thank you. Sounds all good. It's called walking the talk. I'm sure there are only positive comments, so may I ask for any comments? I call on the representative of China.
Mr. Chair, the Chinese delegation appreciates the Secretariat's report on the 2020 to 2021 program budget. This biennium will be the first biennium to implement the 13th General Program of Work and is of critical importance to the ultimate outcome and outputs of the program of work. For the current plan, we think there are a few elements to be appreciated. First, this is truly country-oriented. It has fully considered the national priorities and diverts a lot of resources to the country level, emphasizing the capacity of the country level and also WHO's country delivery capacity. Second, it has paid attention to the collaboration with relevant partners and to strengthen the normative role of WHO, and also attention is given to the information and the data. Thirdly, at the headquarters level, with efficiency, $99 million would be saved. The Chinese delegation would like to ask for explanation or clarification on a few issues from the Secretariat. First, for the 2020-2021 biennium, the total finance level will be increased by 12% than the previous biennium and relies totally on the voluntary contribution. This will increase the unpredictability of funding. We would like to know the considerations and the potential countermeasures from the headquarters and the regional office or the regional secretariat. Second, in the increased volume of the basic budget, about $100 million will be used to strengthen the normative role of the organization, in particular data and innovation. We note that this budget volume is all the same among the 6 regions, and it is $10.8 million. We suggest to add the justification or the basis for such estimate in paragraph 55C. Thirdly, we note that there will be extra $42 million to strengthen the UN resident coordinator system. Just as the Secretariat has explained, this is requested by the UN reform. However, we hope to know more about the auditing and accountability of this extra amount. Last but not least, the budgeting process will include the development of country support plans to coordinate the 3 levels of the organization. China is ready to support and it will be actively participating in such work. Thank you.
Call on the representative of Australia.
Thank you.
Australia would like to thank the Secretariat for the opportunity to comment on the proposed program budget. This regional committee meeting offers a valuable opportunity to further refine priorities, programmatic work and the budget. Australia commends WHO for its increasing focus on delivering impacts at the country level and welcomes the associated increase in funding to country offices, including within the Western Pacific region. The development of country support plans to inform the detailed program budget will be key to identifying country needs and the appropriate WHO engagement at each level. However, Australia does see room for considerable refinement of the proposal prior to Executive Board consideration. So I was pleased to hear that we are only at the beginning of the process. To assist the Secretariat with the next stage, I would note the key areas of concern to Australia are with the existing documentation which you might like to take into account. Firstly, it's not yet clear how the priority setting work and country support plans will inform the budget setting process or drive the best impact for the region and countries. In addition, there's insufficient detail in the agenda paper at present to enable critical analysis of the proposed program budget. We also note that increasing country office level resources will not necessarily result in greater impact at the country level, and care should be taken not to conflate the two. Associated structural revisions within WHO, including human resource capability, mobility and performance management strategies, will be critical to achieving actual country impact. Where it is possible to identify common regional priorities and achieve gains in efficiency, we would encourage this. We also emphasise the need to develop a WHO results framework and consider future performance reporting. Australia has previously called for increased transparency at the country level. With the shift under GPW 13 to increase the budget allocation for country officers and the emphasis on measuring impact at a country level, improved reporting at this level will be increasingly important. Greater detail on how country officers use funding for programs will also promote greater engagement by member states and potentially contribute to improved program design. On a wider note, we have some questions about the feasibility of the biennial budget in the current donor environment. We welcome the organisation's actions to attract new sources of funding and secure upfront commitments, but question whether the proposed increase of $469.1 million US on the base budget is likely to be realised. Should these initiatives fail to deliver the required funding, we'd welcome information on how the funding shortfall will be managed. We also note that the biennial budget strategy provides for an amount that far exceeds the indicative costings provided to member states when considering whether to support the GPW 13. Due to this financial discrepancy, we're further concerned about the achievability of GPW 13 should resourcing not materialise from new fundraising activities. It would also be helpful to contextualise the biennium budget strategy in the bigger picture of resourcing needs for the period of the GPW 13. Thank you again for the opportunity to comment on the proposed program budget. We provide these comments in an effort to assist the Secretariat in its task. Australia would ask that member states be provided with greater detail and specifics of the proposed budget allocation well in advance of the Executive Board discussion on the budget in January 2019 so we can continue to assist in its preparation. Thank you.
Thank you. May I call on the representative of Philippines?
Thank you, Chair. The Philippines congratulates the Secretariat for coming up with the draft proposed high-level program budget for 2020 to 2021, Regional Committee Consultation Document. We appreciate how the document reflected the strategic shift of the 13th General Program of Work towards delivering impact at the country level and the increasing resources at the country office. Specifically, we wish to make the following comments. First, we appreciate the participatory process of involving member states in the planning and prioritization for the necessary transition in developing the program budget, subsequent to and not alongside the development of the GPW 13. Our close collaboration with the country office allowed us to revisit our existing country cooperation strategy for the years 2017 to 2022 in light of the GPW 13. Second, Organizationally, we understand that the country offices continue to depend largely on extra budgetary support, resulting in activities being biased towards areas that attract donor funding. Hence, we are optimistic that with the increase of resources at the country level, such may be minimized and that WHO's capacity to support activities aligned with country priorities would be strengthened. Third, we look forward to WHO's commitment that the final program budget will continue to be needs-based and results-driven, which will not only make WHO's contribution at the country level more relevant and responsive, but more accountable in terms of monitoring and assessing performance. Thank you, Chair.
Thank you. May I now ask the representative of the United States of America?
Thank you, Chair. The United States welcomes this regional discussion of the proposed WHO program budget 2020-2021 based on the 13th General Program of Work. We participated in a similar discussion a few weeks ago at the Pan American Health Organization Directing Council. This is an ambitious budget. It's based on an ambitious General Program of Work. We support the country focus and bottom-up consultative process that is underway. It does ensure appropriate input from throughout the organization and the WHO regions. Several things to note. We recognize the need to begin to shift the polio resources into the base budget. This is important for sustaining routine immunizations, for building health systems, so recognize that. The other thing that stands out to us, and unclear if we should ask questions here or whether it's more appropriate for the board, but the headquarters budget, as Imre, you just outlined, would go down percentage-wise from 38 to 33% approximately. So we're interested in what that means for WHO as a whole, for WHO headquarters, and how it relates or how it works amongst the three levels of the organization. We look forward to greater clarity and detail in the next iteration to be discussed at the executive board. The priorities for the organization, including around areas that are being deprioritized. Determining whether to support an increase in the overall budget level is difficult absent specifics. We are glad to see the current proposal does not include an increase in assessed contributions. We also support the continued focus on broadening the donor base to help with a more stable financing basis for WHO's important work. So we welcome opportunity to be part of this discussion and to set a responsible and appropriate path forward for WHO and WIPRO in the next biennium. Thank you.
Thank you. May I call on the representative of France?
Merci, Monsieur.
Well, thank you, sir. Thank you, Chair. First of all, France wishes to thank the Secretariat for this document, which it acknowledges. It wishes, however, to state that even though this is a preliminary project, the increase that is suggested for this 2020-2021 draft budget must be better argued and detailed. It can indicate that, in fact, it supports the reallocation of resources towards country offices, as stated in the 13 program. But this reallocation must be made possible by savings effected at the headquarters, given the refocusing of the countries, and by sharing the costs that are induced by the implementation of reform of the development system of the United Nations. In this context, the proposal for an increase of resources allocated to the West Pacific region of 11.5% compared to 2018-2019 seems to us not to be a realistic. Delegation would like to recall the fact that it is very much in favor of dialogue on financing once the draft budget will be adopted for 2020-2021. Thank you.
I call upon the representative of Kiribati.
Thank you, Chairman. On behalf of Kiribati government, I would like to take this opportunity to congratulate WIPRO for the progress of the previous biennium budget as delivered in the item 9 of today's deliberations. This indeed shows our commitment to utilize efficiently funding and assistance that had been provided. Regarding the proposed program budget 2020 and 2021, Kiribati appreciates the focus of actions at country level. However, as a small country with just over 100,000 population, we worry that our contribution to the triple billion targets may be invisible or difficult to measure. In a way, we have confidence that WHO and other partners will continue to be with us all the way with their support on the principle of leaving no one behind. I thank you, Chair.
Thank you. May I call on the representative of the Republic of Korea?
Thank you, Mr. Chair. The Republic of Korea would like to acknowledge with high appreciation WHO headquarters and WIPRO's new and ambitious initiative to incorporate national priorities in the program budget in close consultation with the member states and relevant stakeholders. I believe this participatory process will help align WIPRO and member states toward the vision of a healthy Western Pacific and further increase predictability and transparency of WHO programs as a whole. Korea will support the WHO's strategic decision to minimize the budget increase, which is the result of reconciliating idealistic visions and realistic approaches to implement the ambitious triple billion goals of the GPW13. Among the specific targets of the GPW13, I would like to ask for the Secretariat's close attention to the most urgent priorities of the Western Pacific region, which include, first, improving access to quality essential health services. Second, mainstreaming health in all policies and healthy settings. And third, reducing risk factors through multi-sector approaches. In conclusion, it is my delegation's sincere wish that the program budget for 2022-2021 will present practical ideas to realize the vision outlined in the GPW13 and further advance healthcare in the Western Pacific region. The Korean delegation sincerely hopes that the biennial budget for 2020-21 will be successful with the more vigorous voluntary contribution mobilization and the ongoing budgetary reform, as the Secretariat explained to us today. And making the initiative successful, follow up continuous consultations with the relevant governments and stakeholders should go with those efforts. Thank you very much.
Thank you. May I call on the representative of Japan?
Thank you, Chair. GPW13 is an aspirational document with an ambitious goal. We recognize the great efforts undertaken by the Secretariat in reflecting the GPW13 into the program budget, which is a realistic and feasible financial plan. But at this time, the document in front of us remains as high level. In order to proceed further, we would like to contribute some points for clarification. First, this time, the draft budget book is very different from the previous ones. At what stage allocation for each program within UPRO will be clarified? This is the question. Second, unfortunately, often there will be financial gaps between the budget and actual resources. I'm interested to know the strategy to narrow the gap. Third, we would like to hear the view of the Secretariat regarding the changing socio-economical dynamics of this region, where under Dr. Shin's office, we reached an area of no low-income countries in this region, and therefore ODA-dependent business model does not work. Thank you very much for your attention, and we are very much looking forward to working with the UPRO to make progress with Dr. Shin and your colleagues. Thank you.
Thank you. May I call on the representative of Vietnam?
Thank you, Chair. Vietnam welcomes the proposed high-level program budget 2020 to 2021, with the maintaining and strengthening previous bottom-up planning process with wide country consultation on the selection of priority outcomes underpin each of the triple billion goals. We highly appreciate the WHO efforts in increasing the proposed program budget 2020 to 2021 in order to invest in the base component of WHO program budget. On this occasion, we sincerely thank WHO and development partner for your technical and financial support for the healthcare system in Vietnam. We look forward to continuous and fruitful collaboration with you in the coming years. Thank you.
Thank you. May I call on the representative of New Zealand?
Tēnā koutou katoa. New Zealand is pleased to see that there is commitment to monitoring the achievement of improved health outcomes and to refocus investments to implement strategic priorities in line with the SDGs. In particular, we note the strategic intent to delivering impact at the country level. When looking at the proportion of budget planned to be spent at country level, New Zealand recommends that further consideration is given to actually increasing the proportion of the budget that is spent at the country level. Our analysis of the figures presented suggests that while there is an overall proposed increase in country spend, the actual proportion of the total budget by country only increases by 0.06%, so moving from 58.19% to 58.25%. And we recommend that serious consideration is given to increasing that proportion. We look forward to further consultation with you on this.
Thank you. May I call on the representative of Mongolia?
Thank you, Mr. Chair. Mongolia highly appreciates the proposed increase in the 2020-2021 budget. It makes sense as SDG goals only get more ambitious year by year. We have a brief comment on a prioritization of outcomes made by member states. As we all know that a quarter of global burden of disease are caused by environmental health issues, it would be more logical if we could give more priorities to environmental health issues such as air pollution, for example, as it was highlighted by Dr. Shin this morning. Thank you.
Thank you. May I call on the representative of Tonga?
Thank you, Chair. Tonga would like to thank the Secretariat for presenting this proposed program budget 2020-2021. Tonga wishes to express its full support for the bottom-up approach being used to identify priorities based on countries' needs using this proposed budget. Tonga also supports the focus on outcomes rather than outputs. At this point, Tonga wishes to emphasize the need to take note that preparation of budget is a long-term journey where one learns along the way gets wiser as the journey continues. Identifying a country's health needs and gaps in service delivery will be based on capacity of that country to clearly capture service delivery gaps and to identify appropriate resources to fund and fill these gaps. Tonga has developed its own package of essential health services guided by the continuum of care as articulated by universal health coverage through health system strengthening using primary healthcare principles. With this initiative, we anticipate more community and people-focused health services, which align well with outline of this 2020-21 program budget. The specific commitment to the polio eradication program is welcome, and the re-emergence of polio in our region is a cause for concern and a timely reminder that we should never be complacent in addressing the challenges we face. The continued reliance on specified voluntary contribution as opposed to assessed and core voluntary is noted. As we have seen in the past years, the implication of this is the priorities are not necessarily funded to the extent necessary, but rather to the extent possible, depending on earmarked funding from donors. In particular, we have seen underfunding for NCDs, for example, as a result of this. At the UN high-level meeting on NCD in New York 2 weeks ago, we had commitments to earlier commitments. We hope that this in due course our financial commitment from our budget reflects what we say. Thank you, Chair.
Thank you very much, everyone. May I now firstly call upon the Secretariat to respond to the points, followed by the Director General to respond after.
Thanks, Chair. With your permission, I'll ask my colleague Imre Holo to respond.
Thank you very much. So I will try to address some of the recurring issues and then maybe go into specifics. So I should have started by saying that the program budget 2021 you have in front of you is fully in line with the financial estimate that was presented as an annex to the GPW 13 during the World Health Assembly. So the 2021 portion is exactly the numbers that you had in there. The only difference is this addition of 42 million due to the UN reform levy. So that's the first thing I would like to clarify. The second is that the budget that you have in front of you is a fundamentally top-down budget at this high level. And the reason why it's not, you don't have the details is because we need the proper country prioritization exercise and the country support planning exercise to fill it with content. But the decision to how to distribute funds among major offices is driven basically by three things. So on polio, which was the biggest part of the increase, that is directly related to data that we have from 17 countries which are impacted by the polio ramp down. On the 103 million country increase component, we have applied the resolution on the strategic budget space allocation and used the percentages of that and allocated it to each major office based on that, because we thought that that's the best way to make sure that the SBSA is reflected at the end of this exercise. It will be then up to the regional office how the resources will further be allocated among the country offices based on the prioritization exercise. And thirdly, the innovation, data and innovation section, there was a discussion about that within the GPG, and the RDs and the DG decided that 60% of the total amount would go to regions and country offices, and we just simply divided it by the number, that 60%, by the number of regions, because we felt that a certain critical amount is needed in every region, irrespective of the size of the region, in order to jumpstart that very important work. Then some of the specific questions. So maybe the third issue I should say is what will the budget look like at the executive board session? So the budget will be by major offices and by 3 levels of the organization as before, but it will be also divided by the strategic priorities. So we have the 3 strategic priorities plus the 4th, which is the supporting functions. And below that, you may remember we have the outcomes. So we will also break down the budget by outcomes. And what we're currently working on is defining, and we have actually just finished that, the output. So what is the Secretariat contribution to the outcomes, which will be presented and explained, but the budget will not be presented at the output level, will be presented at the outcome and strategic priority level by the 3 levels of the organization. And what makes it a little bit difficult then to read, and I think that was also some of the questions, for example, from Japan, is that before we have done our budget by program area. And the program areas are basically diseases. So if you look at, and they happen to be also departments in headquarters. And that's the fundamental shift, that we're going away from that. So we're not presenting the budget by diseases, but we're presenting the budget as how they're contributing to UHC, or how they're contributing to making people safer, or how they are contributing to making people healthier. It is a very different approach. But we felt that this is needed, and this is very much in line with the GPW spirit, to break the silos and to bring the different elements of the organization together to work for improving basically health. But that will be a little bit of a challenge, I think, when we are discussing it at the executive board. So on going back to the specific question, so yes, we will present the results framework. That will be an integral part of the program budget that you will receive for the executive board. And yes, we heard that you would like to have consultations before that. So we are committing for a timely submission of the program budget so that you have sufficient time to study it before the executive board, but we will also organize informal information sessions to make sure that everybody is on the same page and provide as much information as we have at that stage of the development. And actually the next one is coming up on October 17th in Geneva, where we will use that opportunity to present a bit more detail wherever we are. There was also a question about how the 99 million savings come about. This is, at this stage, a commitment. So this is a commitment and the goal that we have to basically contribute to the expected or the requested budget increase. So we see that we cannot expect that every increase and every proposal is simply covered by additional funding and additional budget, but that we ourselves have to look into see whether there's efficiencies and allocations that we could provide, and this is that. I believe it will be on several fronts. We have started to re-look at our processes and try to see how we can be more efficient. But it will also mean that probably the headcount in headquarters would have to change, and it would have to increase, especially in the country offices. And lastly, on the question about ODA and the fact that the region is becoming richer, what we're trying to do, and this is also related to the budget structure, is to keep the budget at a higher level. And we try to work with our donors to also earmark their funding at a higher level if they cannot give us fully flexible funds. But we acknowledge that internally, allocation of resources have to change if we want to really implement this reality. And currently, it's partly not changing because we're tied by the earmarked voluntary contribution. So I think if we manage to get higher earmarked or more flexible funding, we will be able to allocate more resources also to WIPRO and to the countries in WIPRO. And I think that we have a good chance for that.
Thank you. I will now ask the Director General to provide a response to the points. Director General.
Yeah, thank you. Thank you very much. I will start from the last one Imre had already said, but just I will add to that maybe another dimension. As our colleague from Japan said, the ODA-dependent business model does not work for this region because many countries have already surpassed the GDP requirement to receive the ODA. But at the same time, I mean, the GDP is a very crude measure, and GDP increase doesn't mean that the countries don't need support. So maybe understanding it as such will be important. And one of the solutions we're proposing is the climate change and health, especially for the Pacific small island developing states. And that's why earlier I asked for your support on this region to access the Green Climate Fund, especially the Pacific small islands. As I said earlier, what's allocated for health from the funding envelope of the GCF is only 2%. And that's very small. And we know that all these countries are affected greatly and disproportionately by climate change. And it's affecting the health condition of the countries and areas. So that's why we believe that because the model is not working, the Green Climate Fund could be one option that can help in addressing that problem. And I hope Japan is, I know, concerned by this and will help in pushing the solution forward. Thank you. Arigato gozaimasu. Then on the funding increase, I couldn't find it. I was trying to find where I read it. This was a few days ago. It was about how much the tobacco industry actually invests in advertising and how much WHO's budget is. WHO's budget for everything is not more than 4.4 billion. This is biennium. So per year, it's how much? 2.2 billion. While the tobacco industry invests, you cannot believe it, almost tenfold or so per year for just tobacco. The 2.2 billion is for everything. So the 14% increase, to be honest, I will be honest with you, it's nothing. Because part of it, we're going to fight with the tobacco industry also. We use that for everything. And you can compare it to many other investments that destroy human beings. Investment in the arms industry, in defense. Whatever is being invested to keep the well-being and health of our people is really nothing. I think it's when we compare it that way that we will strike the balance and see the reality. Forget the rest, just the tobacco industry I told you. Maybe you will find it, I will find it and forward it to you. You can't believe how many fold they invest on advertisement, while the total WHO budget is only 2 billion. That should actually make us really sad, deeply sad. And we should advocate not only for 14%, probably more, because we have to fight back. That's how I see it. Of course, when I say this, we also as WHO need to do something different, especially the way we mobilize resources. The old model is not a very active mobilization of resources. That's why WHO has now the first ever investment case. And we have just finalized that and launched it. And this investment case will help us to mobilize resources actively or proactively. And before even the investment case was finalized, we tried to test it by approaching some countries to help. When we proactively mobilize resources, many member states and donors are willing to give. And in the past 1 year alone, among others, I will mention the increase in budget from Australia, from China, from Japan, and from the US. There was increase in the voluntary contribution. And other countries also are not represented here today. Russia increased, Brazil, and these are even new, India, and South Africa is in the pipeline. And even many new are coming, plus those who have been supporting are increasing their support. So if we can actively search, the 14% is not really big. For some reason, I'm very confident on that, because I have seen the signal that there is commitment from countries. When the case is presented properly, they understand the case, they can help. And that positive signal, if we can mobilize it properly, I think the 14% will not be difficult. But in addition to the investment case and finding for new donors and broadening the base of our revenue, we have to make our resource mobilization also innovative. And there are new ideas now coming from the staff that can help us to mobilize resources, new ways of mobilizing resources. We will brief you on this during the member states briefing sessions we're planning in the future. But we are confident that the 14% will be okay because of the first ever investment case, which is getting us good signal. But because of some of the major shifts, like broadening the base of the donors, we have already started. And the new and innovative ways of financing that we are already trying to follow up. But coming back to what I said earlier, the first thing to really addressing the resource gap is from understanding, and really not only understanding, but deeply understanding that our investment on health is really small compared to the tobacco industry, I said, and the arms industry, or the money we're investing for defense. And we have to see it that way. And we have to advocate based on that and convince our leaders to invest more on things that actually bring health and well-being to our people, and not destruction and death. So it's important to focus on that. Then on what do we expect, especially on the board meeting next year? One, as you know, this exercise was supposed to take 2 years. We have compressed it, and the process was completed in 1 year. And the GPW was endorsed it actually last year, May 2018, this year, instead of next year, May 2019. So it was endorsed a year ahead of schedule. So all the processes are really compressed. But we had to do it because the GPW, or the strategic plan, was a precondition for everything we do. It's a precondition for the transformation agenda. As I said in my speech, we want to make WHO agile, and we cannot start transformation without putting the direction or identifying the strategic priorities. And we cannot even write the investment case, which was completed without the strategic plan. And we cannot move with anything anyway without the strategic priority or the direction. And you understand this, and that's why you endorsed it, even if it came ahead of schedule. If we didn't start it, I will be just a new DG, but waiting for 2 years until the new GPW is ready. And that's not, I think, what you wanted. So because of the speed with which we prepared the GPW, many of the things were compressed, because from 2 years to 1 year, it compresses many things. That's why some of the things are, as what Imre said, they are put at a high level still, because there is a need there is a need for time in order to go and do the country level consultations. Then the other factor to this is, and very important, in the GPW, which is compressed, there is a major shift. That's from output into program and outcome based. And that's also what you asked for. And this GPW is entirely different. And something we're asking is, during the board, which we can alert you also now, the outcome based, if you endorse it by outcome, that's the best. Then you can even make us accountable. So you will lock the money with the outcome. And that's why in my speech said earlier this morning, we have already identified indexes for the 3 billion, and we have identified targets and indicators. And this will be linked to the outcomes that we have identified. Then it will be easier to make us accountable. And from WHO side, we will follow 2 mechanisms to measure progress. One is internal, and the other is external. We will continue to do internal measurement based on the indicators we have selected, and that will be internal, plus we will have external. Actually, what we're offering is better value proposition for you. It's not like the output, it's outcome. So you will check whether the outcome is done or not, and there will be indicators and internal and external evaluation, and easier to make us accountable. It's actually more difficult for us when we do this value proposition. But this value proposition is really good for member states. It will put us always on our toes, or what do you call it? And putting us on a very risky path. But we didn't care. By the way, we were discussing this internally last week, and many were concerned. I mean, offering this is difficult. How are you going to really make it? Your whatever is on the line, they said. Then I don't care. This is not about me. It's about serving people. And even if it has risk, we have to make it. We have to give the best offer. Because it's not about one person. It's not about my DG. It's about the whole WHO. It's about the people we serve. And we have to be honest. We cannot put something that we can achieve easily as outputs, saying we will train this many or we will do this many. No. We will have this many meetings. Or I will prepare this many guidelines. No. It has to be measured based on impact and outcome. And we have to see WHO's contribution in line with that. If there is risk to be taken, it has to be taken. If anyone's position is on the line, it has to be on the line. That's how we can make progress, by being honest with you. So what we're offering is actually good. And you don't need to go into details. Why do you want to micromanage? I'm being honest with you again. Just follow the outcome. You can track us based on that. Otherwise, okay, small money attached with each program and so on. What does it help you? What does it help? The outcome is more important. And I'm being honest with you. That's what we are saying we can offer. And you're giving us trust and responsibility. But at the same time, it will be measured internally and externally. Because even if you trust us, you need to verify. Trust, but verify. That's how we're trying to put even the whole model. And that's why we're outlining the indicators properly. And this is good value for money. And this is good value proposition. And it's very different. If we're prepared to shift from output to program and outcome, then we have to change the way we interact also. One shift should bring another shift, meaning outcome and impact-based planning should be accompanied by a different level of relationship between us and you two. So I think that has to be considered when we prepare for January for the board meeting, because we can't have it both. If we're saying impact and outcome, then it needs level of, what do you call it, delegation and freedom or independence for WHO to do its job and bring the outcome rather than focus on output and using the old model. We're asking for shifts. We're doing major shifts internally. So we are asking also for some shifts for our relationship too, because it takes two to tango. You can't have big shift internal and then you can't, without a shift external, it doesn't work. It doesn't work. So that's how the whole direction is. And I hope you will support us on this and bring the result together. Thank you. I don't know what it means, but Kia orana ecomania.
Thank you, Director General, for your very comprehensive and very passionate response. And we thank you and commend your leadership in managing the processes that you have outlined. If there are no further comments, the Secretariat will summarize your comments and discussions on the proposed program budget for 2020-2021 to feed into the Executive Board's discussion on this issue in January. If there are no further comments, we can close this agenda item. Thank you. I think you have all worked very, very hard and you deserve the break for the day. But before we do so, may I call on the Director, Administration and Finance for administrative announcements.
Thanks very much, Chair. Just a couple announcements on transport arrangements. As usual, the buses are out front waiting for you to take you back to either the Manila Hotel or the Rizal Park Hotel. And a little bit about tomorrow morning, because it's an early start for member state delegates. The session will start at 8:30 in the hall, and we'll provide transport starting at 8 a.m. for delegates who will attend the private session. And if I could ask you to help facilitate a quick start at 8:30, when you come in tomorrow, can you please show your badge to the security folks who will be in front of the doors. And then for those of you who won't be here for the private session but want to join when it's over, we'll set up a second transport for any other RC participants from the Manila Hotel and the Rizal Park Hotel. And that will be at 2:15 in the afternoon. And we'll ask you to congregate in the cafeteria until the private session is finished, at which time an announcement will be made to recommence the plenary. Thank you, Chair.
Thank you, Mr. Kobja. The committee will now reconvene tomorrow at 8:30 a.m.
Well done. Very good. Excellent, sir. Very good.